Hey guys, this is Dr. Hub. Today we'll look at the pregnancy and we are focusing on the cardiovascular changes. So some important pointers it includes the resting pulse rate. The resting pulse rate is what happens is it increases by 10. So 10 BPM it increases. So the apex, it is moved laterally. The cardiac output, it is elevated throughout. So it is elevated throughout. The maximum is in the immediate postpartum period. So the max is seen in the postpartum period, which happens immediately. So the X-ray, when you look at the X-ray, it shows a large cardiac silhouette. So this presence is due to a benign pericardial effusion. So due to a benign pericardial, so it is due to a benign pericardial effusion and a shifted apex So upon ECG, there is a significant finding. In ECG, you will notice a slight left axis LAD, that is a left axis deviation. Now let's look at the heart sounds. So under the heart sounds, there is a first heart sound. The first heart sound, it is loud with an exaggerated split. So it appears loud and this is with a exaggerated. So there is presence of a exaggerated split. So it is loud with an exaggerated split. Now let's look at the second. The second is also normal, but it is increase in loudness. So the loudness, it increases. So let's look at the third. So in terms of the third, it is loud and it is heard easily, easy to hear. Now let's look at the murmurs. So going by the murmurs, there is a systolic murmur. There is presence of the systolic murmurs. So the systolic murmur that was intensified during inspiration or expiration. So it is intensified. You can tell it is intensified during inspiration or the expiration. Then there is a soft diastolic murmur. There is a presence of the soft diastolic murmur. So this occurs in terms of 20%. And there is a continuous murmur. So there is presence of a continuous murmur. And this murmur, it arises from the breast vasculature. So this murmur is from the breast vasculature and it amounts to about 10%.